Hi everyone, it's been for a while. I am Shuichi FUKUNAGA, a Japanese orthodontic doctor running a private clinic in OMIYA, Saitama City, Saitama Prefecture. I specialize in occlusion, orthodontics, and oral and maxillofacial surgery. Well, this time I would like to explain in series about teeth contact or occlusion, but many people might find it difficult to understand if I discuss technically. So I devised door hinge analogy, which makes understanding occlusion more easily. I will tell you the reason why our teeth can be preserved and why TMJ disorder can be treated by improving occlusion. You might believe that you have good teeth contact or occlusion if you don't feel any discomfort when chewing or when you have beautiful front teeth alignment. But actually, occlusion has something to do with the condition of jaw joint. And occlusion should always have a harmony with jaw joint. It means that jaw joint shouldn't be shaken during eating and grinding. Moreover, the treatment of occlusion isn't just about changing how the teeth contact with one another. The real treatment of occlusion is to prevent the jaw joint from shaking during eating and grinding. At first, I'd like you to watch this 6 minutes video.
This is mock was set for diagnosing and treating jaw joint disorder of 20s female patient. The chief complaint was first she couldn't open her mouth widely. I will show you the cause now. Let's see her tooth contact together. Here, two molar teeth get stained with a color checking contact better than surrounding teeth. These teeth are protruding, so these two teeth become so-called a fulcrum of seesaw. I will show you what's going on her teeth contact. When she closes mouth, at first these two teeth get contacted, and then lower jaw shift. After that, all teeth get contacted. Her teeth contact was like this. These parts are the portions of our jaw joint. What will occur on these parts TMJ of human? Look at these parts. You can see seesaw movement like this.
こういう
Why
ガ
does
チャガチャガチャ
seesaw
ガチャいうのです
movement
ね、
occur?
こういう動き
You
が
have already known the reason yet. There are two protruding teeth as a fulcrum of seesaw, and there are these teeth not to contact still now, and there is jaw joint.
ですので
These three things creates seesaw movement. So when eating meals, her jaw joint is always shaking, and it leads to TMJ disorder. If I mention another important thing, when not to only eating meals, but also grinding for releasing stress at night, jaw joint shouldn't be shaken by seesaw movement. When her lower jaw go right molar tooth become a fulcrum of seesaw, and right jaw joint is shaken hard. Next, when lower jaw go left, how does jaw joint react? In the situation compulsory left jaw joint is shaking hard. There is a tooth being fulcrum of seesaw on the left side. If the teeth being a fulcrum of seesaw will leave them alone, the teeth are going to have gum disease progressing, even though you brush them carefully. It is attributed by seesaw movement of bad teeth contact or occlusion without relating to oral bacteria. And seesaw movement of bad teeth contact leads to tooth fracture. After that, those teeth of gum disease or fracture could result in tooth extraction. This smoke has got stained because I tried to level the protruding teeth through shaving on the mock to use articulator before what I actually carry as shaving with patient. Now, all teeth have contacted at the same time in this mock, so jaw joint quite haven't shaken yet. To compare with what I showed you mock examining patient at first few minutes ago. In fact, I leveled the protruding molar teeth through shaving to the patient, and I carried out the examination after treatment because I wanted to show her the evidence of what she got ideal teeth contact. So the best time in doing this examination should be post-operation. Actually, I always verify if my treatment gets successful. As a result, her tooth contact doesn't have seesaw movement. Her jaw joint doesn't shake. That's all. I usually treat TMJ disorder like this, and then I always show my patient the evidence what they get ideal teeth contact.
Thank you for watching that video. As you have seen in the video, occlusion is an important field because it relates to all dental practices. The concept of occlusion started with the study of people with natural teeth about 1 century ago in the 1920s. The purpose was to find out what keeps the teeth and jaw joint healthy. The key point in understanding occlusion is that everything that opens and closes to rotate has a hinge axis. A couple of examples are the door and our lower jaw. If there is a protruding nail in the closing path of the door, as in the diagram here, the door hinge shakes, and if this persists, it will eventually be broken with the constant opening and closing of the door. Such closing of the door forcefully is similar to clenching of the teeth when we bite or chew. In most cases, the nail itself can also be deformed by the impact of the closing door, especially when we apply stronger force to close it tightly. Similarly, if there is slightly protruding molar tooth or tooth material like filling or crown interfering with precise teeth contact in the closing path between the lower jaw teeth and the upper jaw teeth, it can shake the jaw joint which serve like the hinge axis, just like the nail. And this is the root cause of TMJ disorder. Slightly protruding molar tooth also can cause sensitivity over toothache even without cavities. Gum disease or tooth fracture due to bite force or impact. These things show us that jaw joint and occlusion have a relationship like they are two sides of the same coin. Poor occlusion will cause damage in both of them in the end. One of the cases of bad occlusion is the presence of a slightly protruding molar tooth which shakes the jaw joint like a nail, interfering the closing of a door that leads to the loosening and damage of the hinge. Controlling the impact of bad occlusion on jaw joint is more proper prevention of this problem than just controlling or bacteria through brushing, especially for people to over their 20 years old. They should start to pay attention to their dental health and keeping the jaw joint healthy contributes directly to longer lasting teeth. This is the purpose occlusion treatment. Improving bad occlusion requires quality professional care provided by dentists, and it is different from home care that you can do. It is a measure for preventing tooth loss caused by gum disease and tooth fracture, and for treating TMJ disorder. You may have believed that brushing your teeth properly is the only care you need to keep your teeth healthy and to prevent dental problems. Almost all people probably receive treatment at dental clinics, which conduct examination without using what I call the three sacred tools. Those dental clinics usually don't think that these problems can be prevented by occlusion and that TMJ disorder can be treated by occlusion. The dentists working at those dental clinics believe that there is ideal occlusion when patients don't have any discomfort during chewing and occlusion don't have essential role for the treatment of dental problems. Therefore, patients often don't get to know the truth about occlusion. Have you ever taken occlusal examination before treatment? Perhaps the treatment starts immediately after the 3D lay test. Almost all dentists try to make beautiful teeth alignment of the front teeth or try to restore a tooth using implant treatment like magic as a matter of course. But I think it's not enough. Dentists should look after the future of all the teeth of their patients. We should strive to preserve our patient teeth and maintain the health of their jaws. Improving occlusion can make these come true. Good occlusion puts the teeth and jaw joint in good condition without harming the patient's health. On the other hand, bad occlusion works like a hindrance that impacts the jaw joint whenever a patient chews and grinds in their daily life. Therefore, people should think why a tooth becomes sensitive and why a severe toothache occurs even though without any cavities. Why gum disease progresses even though they brush their teeth diligently. Why tooth fracture suddenly occurs. These causes can be attributed to teeth occlusion. Dentists to try to investigate the cause, but often they try to treat the symptom but not to the problem. So they apply medicine to sensitive tooth. They try to remove the nerve or the tooth with severe toothache, even if this has no cavities. They advise that you should brush your teeth more thoroughly when you have progressing gum disease, even though you brush your teeth diligently. They tell you even like you had the habit of grinding or clenching your teeth or eating hard foods when tooth fracture suddenly occurred. But actually, they just didn't consider checking your occlusion if it's good or bad. In many rare cases, it's just having bad teeth contact, where one molar tooth is slightly higher than the rest. The molar tooth that messes the hinge axis of the jaw joint. Thank you for watching this video.